A very good morning to you all. I am Dr. Divakar Raju. I am a specialist orthodontist. I've been practicing orthodontics since the last 15 years, and currently I am working in Hamdan Medical Center, Al-Ain, UAE. Thank you for opting for the free gift, and the free gift will reach you in a couple of minutes. What I have found is the patients who are interested in the document which was sent to you are also interested in knowing what are the five important factors to be considered while going for dental braces. Now, before that, I would suggest that the brochure that has been sent to you has some valuable information. So kindly take out a few minutes of your time and go through the points that are mentioned in the brochure. Now, when we consider, when we think about what are the five important factors to be considered before going for dental braces, the first and the foremost thing is the age of the child. That is the first and the foremost thing to be considered while going for dental braces. It is very important that you bring your child for an orthodontic consultation at the age of around 8 years. The American Association of Orthodontists, which is a very highly reputed body in the United States of America, suggests that every child has to be taken to an orthodontic consultation at age 7. Okay, so I think the brochure that you've got will also speak about this point. Now, why is it so important? Why is it so important that when my child is still having baby teeth? Why is it so important to go for an orthodontic consultation? And the reason being, when a child is still growing, the facial structures are changing, the jaws are still growing, the facial balance is not fully established. And when we have an opportunity to intervene at that time, when the growth is still happening, when the facial balance is still not established, number one, it is easy to achieve the desired results, and number two, it is easy to make the results stable, because we are working with a changing environment. So when we move teeth from one place to another, what happens is the muscles of the face or the muscles of the tongue, they adapt to the new position of the teeth. Thereby, the teeth are in a very much stable position when corrected earlier. On the contrary, if I was supposed to see, if a child is brought to me when the child is 15, 16, 17 years of age, when the growth is almost complete, we can still do the correction. But the issue is that we are working in an environment which is already established, where the facial balance is already achieved, when the facial growth is over, when the jaw growth is over, but still we are trying to make the correction in the position of the teeth. It is possible, but the duration of treatment is longer, the treatment is harder, and we have to work hard to make the teeth stable in the already established facial environment. So it's very important that the child is seen much earlier. I've been doing these early interventions since the last 7 to 8 years, and I've been getting phenomenal results with that. I'm seeing what the treatment is actually, how it is improving the quality of life to the patient. That is what I'm very passionate about, early intervention. For example, there was this mother to whom I just spoke about the early intervention, and she happened to get her child, and we went for a routine examination and x-ray, and we found that for the child, the upper canine, which is the last tooth to come in the oral cavity, was not straight. It was angulated and it was getting impacted. If I had seen this child when she was 16, 17, 18 years old, we can still bring the tooth down, but it would be a surgical procedure where we have to open up the gums, cut a little bit of bone, put a bracket onto that impacted tooth, and then upright it and get it down. First thing is a surgical procedure. Second thing, it is a very time-taking procedure. For the canine to bring it down, it's going to take somewhere between 12 to 18 months just to bring down one single tooth. But in this case, since the child was brought to me much earlier, I could see that the canine was getting impacted, and by a simple extraction of the corresponding milk tooth, we increase the chance of that canine coming down by itself naturally by 30%. We increase the chance by 35% by just simple extraction of the corresponding milk tooth. And if I add an expander inside, which will provide more space in the upper jaw, we increase the chance of the canine coming down by 65%. Non-surgically, we do not do any surgery, we do not open up the gums. I mean, imagine, that gives me so much of satisfaction that I have saved the child a surgical procedure by seeing the child at an early age. So that is what is very rewarding, and that is what motivates me to keep going in this direction. Early intervention is the future. Two-phase therapy is the future. And also there have been instances where the tongue is tied to the floor of the mouth. There is a small flap of tissue which attaches the tongue to the floor of the mouth. Now in such cases, what happens is, when the speech is affected, parents pick it up early. Parents are able to see that something is wrong with the child, she is not speaking well, so then they seek attention. But not in all cases the speech is affected. In some cases the tongue is tied, but still the child talks well. So you might ask me, if the child is speaking well, then what is the issue? What is the need for intervention? See, normally for the growth and development of the upper jaw, there are two very important stimulants, you can call them stimuli. Number one is the tongue. The tongue has to apply force on the upper jaw for it to grow to normal size and for it to grow to the normal position. The upper jaw, the size of the upper jaw is determined by two sets of muscles. One is a set of facial muscles acting from outside, other is the tongue muscle which is acting from the inside. So these two forces are acting simultaneously on the upper jaw, thereby causing the upper jaw to develop in its right size and to be positioned in the right place. Now imagine what happens when the tongue is tied to the floor of the mouth and there is only the face muscles that are acting from outside. So there is only pressure and force from the outside, whereas from inside there is no pressure, there is no force. So what happens? The upper jaw does not develop to its full size, and it does not come forward to the actual position where it should be. When the upper jaw is not developed to its full size, the lower jaw also does not develop to the full size. When both the upper and lower jaw are not developed to the full size, they don't get enough space to accommodate all the teeth. That is why you see that the canine is getting impacted, and they have a lot of crowding and all these things. So all these things could have been avoided by just removing the tongue tie at an early age, when the child is still developing, when the growth is still left out. I mean, what would I do if I see a child at 17, 18 years of age where the growth is already complete? We cannot do much. So that is why it's very important that we see the child early. And also there are instances where one single tooth, for example the upper four incisors, out of that one incisor is wrongly positioned like that, inwardly positioned. Now this one single tooth which is inwardly positioned can affect the growth of the entire lower jaw and the upper jaw, this one single tooth. So most of the parents are not aware of this. Most of the dentists are also not aware of this. So that is the reason why we have to see the child early, and this single tooth correction is a very, very simple procedure. I mean, it will take hardly 4 visits to an orthodontist. We can correct the position of the single tooth, allow the teeth to develop in a normal pace, allow the jaws to develop normally, whereby the child will get a beautiful balanced facial profile. Okay, so that is very important that we see early. And there are instances where a child has an altered swallowing pattern. You swallow and see where is your tip of your tongue when at the time of swallow. If it is behind the upper front teeth, you can say um, like a centimeter, 1 centimeter behind the upper front teeth, that is the right position of right swallowing pattern. But there is an altered swallowing pattern wherein kids put their tongue in between the upper and lower teeth and swallow. There have been altered swallowing pattern where the kids put their tongue on the upper teeth, on the back side of the upper teeth and swallow. So these are altered swallowing patterns which the parents are not aware of. So when a child is brought early and she is still developing and there is still growth, and I pick it up, I pick up that the child is having an altered swallowing pattern. I educate the parents, I educate the child. We can work with the child to correct the swallowing pattern, and when the swallowing pattern is corrected, it will help in the normal development of the jaw and the face. So these are the factors that can be treated at an early age. So that is why it's very important that you bring your child at the age of around 8 years for a checkup. Okay, I do not say that all children of 8 years need orthodontic braces, but I am telling you is a checkup is a must, so we get a chance to identify what are the problems that the child is facing. I mean, if there is no problem, the child is developing well, then you are happy, I am happy, we'll let the child develop normally. But when there is a problem which you are not aware of, that is where I can help you identify the problem, and I can suggest to you what are the interventions that are possible so that your child gets a beautiful, well balanced face. Thank you. Have a wonderful day ahead.